Hello, I'm Dr. Dennis McKenna. As always, I'm joined by Dr. Fred Venditti, our Hospital System General Director. Today's Thursday, August 26th, giving you the update from Albany Med. All right, Fred, we'll jump into the graphs. First one, Capital Region. Currently 121 in hospital beds diagnosed with COVID. Fred, interesting number inside that, 23 are in ICUs. And I went back and looked at the graph. At one point in the Capital Region, when we had our highest number of admissions, we had 100 people in ICU beds. So it's interesting to see that number there.
Right, Dennis. I think, we've talked about this before. The severity of illness right now that we're seeing is not quite the same as the last surge.
We did have our regional call today.
We did.
Anything that you'd like to share?
So it's a little bit bigger area, 143 in-house. Interestingly enough, the number of new admissions over the last week declined a little bit. So this surge is following the pattern we've seen before.
Next graph is specific to Albany Medical Center. That's admissions and discharges, so we put that up there for you to take a look at. And let's pop up the next graph here, which is our morning census. Currently, Fred, 29 in the hospital here, 24 on the floor, 5 in the ICU, 1 on a ventilator. Let's break those numbers down a little bit more. The 29 is 26 adults and 3 peds.
That's right. Within
that 29, there are 5 that are no longer infectious. Sometimes we talk about that.
Right.
So really, we're treating 24. And to the point you just made, at Albany Medical Center, over the last 7 days, we had 18 come in and 16 go out. So like last week, pretty much in balance.
That's right. We've been hovering in the mid to high 20s now for about 10 days.
For those who may have not remembered when you've said this before, because you've said it a couple times, talk about the typical pattern of what happens in the community, then to hospitalizations, ICUs, and beyond.
So this is the third time now, Dennis, that we're seeing that pattern. So first, the positivity rate goes up, so we see more positive cases. Then the hospitalizations follow that, and about a week or so, maybe a little longer, that rises, and then deaths follow that.
So it wouldn't surprise you in the next week or two if we started to see the number of ICU numbers go up a little bit.
That's right.
Okay.
And the deaths, Dennis, that we do talk about here periodically.
Right, for sure. The percent positive in the region, which is another metric we've talked about, we're currently over a 7-day rolling average of 4.4%.
That's right.
And in fact, yesterday it was under 4.4. I think it was 4.2.
4.2 yesterday. And we peaked at about 4.7.
So we never crested over 5.
That's right.
And people may remember back during the second surge, we had as many as, I think, 10 or 12% sometimes in that number. So we're encouraged by that. We see that number kind of plateauing.
Yes.
All right, we'll keep a close eye on that. Fred, let's talk about vaccines a little bit. We know that New York State has now come out, obviously, with the mandate for healthcare workers, and the regs have been published, and now there's a guidance document which came out as a result of those regs. You participated in a call earlier this week. I think you were asking some questions as far as clarification. One area that I think now has more clarity around it is whether or not the vaccine is safe and effective for people who are pregnant, people who are thinking about pregnant, or people who are lactating, breastfeeding. And would you like to share what we've learned?
Yeah, Dennis. So as you said, there was a call with the commissioner, and multiple institutions were on that call around the state. And one of the issues that did come up is exactly that: pregnancy, lactation, and wanting to get pregnant. And so the regs say certain things. And then this always happens. The Department of Health clarifies and gives more guidance, including with FAQs, frequently asked questions. So that came out on Tuesday around pregnancy specifically. And the first FAQ in that guidance is a question: is pregnancy alone a reason for exemption or deferral for the vaccine? And the answer was no.
Okay.
So pregnancy alone, per New York State Department of Health guidelines and regulations, say that pregnancy is not an appropriate deferral. And in that document, which is posted on the intranet, Dennis, there are references that back that up. There's a lot of science. Women who are pregnant who get COVID actually tend to do worse than others who are not pregnant. The fetus can be harmed by the infection. And so there's lots of information in that document. If you're interested, you can go and look at.
So we know, obviously, we have a lot of members of our workforce who would be very interested in that. We've posted it on the intranet site. And honestly, I'll just say this: if you have any questions, if you can't find it, just reach out to Dr. Venditti or I, and we'll point it to you, because we want to make sure you have all the information.
That's right.
Fred, another study that was recently published in MMWR, which is a weekly scientific periodical that you talked about in the past, called the Heroes Recovery Study. And I know you wanted to share the results of that because it will inform what's going to happen in the future related to boosters.
That's right,
Pete,
Dennis.
over to you.
So the CDC and the FDA are looking at data to try to make informed decisions and
Right.
recommendations around boosters. And so this is a study, it's the HERO, as you say, the Heroes Recovery Study. It's out of Arizona, it's healthcare workers. And what they did was they tracked them over time after they were vaccinated. And there are two main points that come out of that study. Number one, the effectiveness of vaccines pre-Delta was 91%. In the Delta era, it's dropped to 66%. So still very significant protection, but not quite as much as before. The second point that the study makes is over time, when you get to about 5 or 6 months, the effectiveness of the vaccine wanes a little bit.
Okay.
It drops from 90% to 73%.
Okay.
So still very effective, but
it goes down a little bit.
That's right. And that's why the CDC has begun to talk about boosters and made the recommendation that at 8 months, boosters are probably appropriate.
Boosters, of course, are something that we're very familiar with in medicine. We can name any number of immunizations that in the past have a booster as part of their normal maintenance. Many of us, Fred, you and I both have said, we need to start thinking about COVID as something that we're going to have to work with, live with on a going forward basis. Boosters as part of that, really to me, is just consistent with that position.
It is.
Something that we just get, like we do an annual flu shot or other types of boosters.
Absolutely, Dennis. I think
right.
that's our future.
Okay, very good. Let's shift gears. Let's talk about a couple things happening on this campus. Fred, for a while now, we've been talking about managing the flow of people into the hospital, visitors specifically, in a way in which we can do it very safely. I know our security team has been working very hard to try to create as safe an environment as possible. Today, something being rolled on the campus called FastPass, which we think is going to help them do that much better.
Absolutely, Dennis. So this is an electronic system that's in place at the west entrance, B2, the concourse,
Right.
and in both emergency room entrances. And basically what the security folks are going to be able to do is scans someone's driver license. That information gets imported into the system, take a quick picture, and then give them a badge that has their information and their picture on it. So it will really help us know,
Right.
In a very organized way, who's coming in and who's leaving the institution.
Right.
So who's in the institution at any moment.
We're a big place. We have to be very, cognizant of who's here and how long they're here for. So in the future, having either a work ID badge or the FastPass is really what you would need to have to be on the campus here.
That's right. So
Good.
in the next couple of days, you're going to see people with badges that have their picture on
Good.
them. So
Good.
look for that.
Congratulations to security for making that happen.
Great job.
Fred, the Eye Care Award, we had a great presentation at CCLM this week again. Two very worthy honorees in the Eye Care Award, compassion, accountability, respect, and engagement. They work in human resources. They worked on the Workday rollout. And I think for anybody who was there, anybody who's seen the video, can say that they embody the spirit that we want in the Eye Care Award. So who were they?
So Dennis, that was Zach LeMay and Alexis Izzo.
Right.
So, shout out to them. Fantastic job. Workday was an enormous project and really has come out quite well for us.
And they're on that customer service end where if
Yes.
somebody has any questions, and you could see when they got their awards and they talked a little bit that they really are very people-centric, and that I think they're probably wonderful at their job as far as giving help.
I'm sure they are.
Fred, Get With the Guidelines is something that the American Heart Association gives awards out to institutions who really excel in certain areas. And in the past, Albany Medical Center, Albany Medical College has been the recipient of awards in this area, and the same is true again this year.
That's right. So this year, the Get With the Guidelines Gold Plus Quality Achievement Award in Heart Failure was received by the Medical Center.
Right.
And this is about very careful attention to detail on the care of patients with heart failure.
Right.
Now, Dennis, we've received gold awards in heart failure for multiple years.
Right.
And I have to tell you, this is a credit to the team that's been working on
Great
this.
team.
Multifaceted or multidisciplinary group. Dr. Ed Philbin,
Yep.
who's the chair of medicine, has really been the leader of this team. Too many people on the team to name, but shout out to the group. Fantastic job.
Great group. And Dr. Philbin is a nationally known heart failure expert.
He is.
And there was another award, I think, related to diabetes as well in the realm of preventing heart disease.
That's right. And so that's the Target Type 2 Diabetes Honor Roll that we've been named to as well. So again, Type 2 diabetes does play a significant role in heart disease and something to be very carefully managed, which our team does.
All right, today's Thursday, so we'll finish with recognition that I think over 100 members of our workforce tonight will be at the Altamont Fairgrounds, the CDPHP Workforce Challenge, 3.5 miles. I'm going to be there. I look forward to seeing everybody. If you're watching this video and you're getting ready, stretch, hydrate.
Absolutely, it's going to be warm.
Yeah, but it should be great, and we look forward to moving forward together, as our shirts say. We're moving into the weekend, and we want to thank our staff who will be here taking care of people all weekend.
Thank you.
All right, we'll be back again next week. We ask that you once again, please take care of yourself, take care of each other, and we'll see you next week.